Friday the 28th. Radiation has long been a tool used to prevent breast cancer from recurring, and we know that process can be grueling and it can also be time consuming. But imagine turning 6 weeks of treatment into 1 day with the same results.
So promising, right? MedStar Health was one of the first in our area to use this faster therapy to fight early stage breast cancer. Marcella Robertson has the details.
Dr. Marc Boisvert is the chief Washington regional breast surgeon for MedStar Health. For more than 30 years, he has worked to save the lives of women diagnosed with breast cancer.
I'm from the era where everybody got a mastectomy when I first started out.
More recently, his work has focused on an innovative new technology.
And our focus now really is to try to de-escalate surgery, just de-escalate radiation, de-escalate medicines with heavy toxicities if we can, and we're making progress there.
Radiation treatments are crucial in preventing cancer from coming back, but those treatments sometimes require patients to come in 5 days a week for up to 6 weeks at a time. Now, there's a faster option that's just as effective for women with early stage breast cancer. It's called Intraoperative Radiation Therapy, or IORT.
It's sort of tailor-made for the patient population I serve, the patients who really can't take time off work, they're caring for other family members, they need to get money in the house so they can eat.
IORT is a one-time single high dose of radiation following a lumpectomy. The treatment is not just a big advancement in the fight against cancer, but also for access. Because of the time commitment, sometimes patients simply don't get the recommended radiation.
And then they come back with a breast cancer recurrence in a couple of years. It's very disheartening to see. It's terribly devastating for them, and it doesn't need to happen. It's just such a wonderful treatment for these patients. It's so time-saving and so free of side effects that I'd love to see the indications expand.
So would all of us. That was Marcella Robertson reporting. MedStar Health was one of the first hospitals in our area to offer this kind of treatment, as we mentioned. And an important note, though, this treatment, again, only works for early stage breast cancer. The full radiation is still required in those later stages and more aggressive cases.